Good morning to the healthcare leaders. My name is Sana Abrol, and I'm an epidemiology expert working within Hunter, New England local health district. And today, I will enlighten you about our evaluation plan of long-term effectiveness of COVID-19 vaccine within our region. So, without any further ado, let's get started. So I have enlisted these as bullet points. So we would be covering about the aim of our evaluation plan, challenges, ideal leadership style that we used in our study, the risk with the management steps, the budget estimate, along with all the topics and points leading to our conclusion and also our future steps that we would be using. So, like I mentioned earlier, aim is basically to evaluate, to develop an evaluation plan of measuring COVID 19 vaccine effectiveness based upon the durability as well as the long term effects. Now, these 2 points are of paramount importance because of these points, we developed vaccination strategies which leads to protection of people because the protection of people is our main goal, being a part of a public health team. It is an undeniable fact that uh, with each challenge that we face, it leads to an evolution of our healthcare. So, the first challenge that we faced was to measure the vaccine effectiveness with time. As can be seen in the line graph, with time, the effectiveness of vaccine effects has been shown to wither away. So, by taking this into consideration and by developing an optimum evaluation plan, this can be minimized. The second most important vaccine effectiveness challenge was by emergence of new variants. Now, even in this line graph, it is shown that the variants like the Delta variant led to decrease and decline of vaccine effectiveness, which ultimately led to decrease in immunity and led to a rise in rate of transmission. The third challenge that we faced was basically revolved around the social demographic features. Now, this picture basically provides a snapshot of the demographic features, especially in our case study. We conducted interview and we also studied the effects of vaccine effectiveness with based upon the old age and whether the patient suffered from any previous infection, and all of these factors led to a conclusion that because of these factors the vaccine effectiveness declines. Because this is a very complex study, so we basically analyze all kinds of leadership styles and we made an inference of using transformational leadership style. Now, the basis of transformational leadership style is by the use of 4 I's, that is, ideas of idealized influence, individualist consideration, and inspirational motivation, intellectual stimulation. Transformational leadership style is very apt for this type of study because not only healthcare leaders, but also they involve all the team members and work collectively as a team. And the main motto of the transformational leadership style is vision and mission. And also, would like to add one more point in this slide that by modeling the way, that is, the leaders model the way that they want other team members to act. So they also act in a similar manner. Now, the management steps by quarter proves to be an adjunct with the transformational leadership style. So, the first step was that we created a sense of urgency. We made our team members aware that it is a very urgent matter because of, especially of the emergence of new variants. So, with time, we saved the time and then we built our multidisciplinary team that basically included epidemiologists, biostatisticians, tech engineers, etc., which led us to enable our action accordingly. And we also generated the short term wins. So these steps are basically consistent. So, and we made sure that the cycle was basically on a consistent basis because consistency is very important for success for any evaluation plan. So, this study basically impacted on 3 levels: impact on people, impact on technology, as well as impact on organization. The impact on people was that it led to us upgrading the skills of our team members by ensuring that impactful communication was conducted within our HNE LHD by improving data evaluation strategies, and Because this is a modern era, so it is of paramount importance to upskill technology. We used various softwares like statistical analysis software, R-based software, and also survey platforms we used, because survey was very important to make sure what people thought about and what they experienced after the COVID-19 vaccine, uh, by when they got vaccinated. All of these changes led to the changes within our department, within our institution of HNE LHD. It led to us enhance. It led to the enhanced partnerships and collaborations with other institutions and team members. We conducted meetings on a regular basis, and then it led to team-driven projects. But there were also downsides that we encountered because it was a very high and advanced level of study. We experienced increased level of workload and burnout. So, with each risk and each challenge and problems, there are always management steps available. That is a good thing. Because this was a very advanced level of study, our staff experienced hesitation to state their viewpoints because of also lack of skills. So, we made sure that we provided transparent and crystal clear communication to them by training them regularly, by basically assessing them on a regular basis, and also by providing teamwork. Also because there were changes in policy encountered uh, with time, so we made sure that we regularly monitored that. So the results that we anticipated were the short term and long term. The short term success basically revolves around using reliable resources to basically combine the data, like I mentioned earlier, by using statistical analysis tools, which led to the sharpening of critical thinking skills, of analytical skills within our team, and also we paid major emphasis on ensuring that there was a multidisciplinary team always there in within our institution. The long term success led to upgradation of vaccination strategies. Now, because of upgradation of vaccination strategies, it not only leads to solve the problem of COVID-19 vaccine effectiveness, but also would prepare us for future pandemics, which ultimately leads to better public health outcomes, which leads to us gaining the trust of people. So we use two types of strategies to evaluate our program, the quantitative and qualitative. The qualitative ones basically revolves around us seeking feedback from people, particularly here I would like to state the 360-degree feedback, where we seek feedback not only from leaders but also from staff members as well as from people. And by using quantitative tools like advanced AI tech tools like SAS tools, by comparing the effectiveness of vaccine by vaccinated as well as unvaccinated people, and also by measuring cumulative incidence, which refers to monitoring new cases. Our budget estimate for this program comes around about 689 $450,000, because we created our budget based upon including all the departments of all sectors, like here Evelyn listed the advisory group, the statistics group, epidemiologists, biostatisticians, along with all the other groups. So all in all, we can overcome, and we have overcome these problems by providing clear and transparent communication, by providing rewards to people, and also there is a risk of also encountering bias, so we made sure that we selected people on a random basis by advanced staff training and assessments, as well as by expanding our collaboration with our other institutions and surveillance staff. So, I would like to conclude this topic by saying that for future steps, we envision to collaborate with more research institutions, because there is no harm in seeking advice and guidance from the research institutions to make sure and to ensure that we stay on track by collaborating with AI engineers, because this is an AI based modern era, and it is always very beneficial for us because it leads to improving workload efficiency. The time is saved, so we can focus on all on other important topics, and it also leads to solving problems. Follow up beyond 1 year is also very important, because if we basically evaluate any evaluation plan for less than 1 year, then we can't really rely on that because we never know what in 1 year we can experience. Like, for example, we experience mutation of COVID-19. So definitely follow up by 1 year is very important because then it will help to examine as well as analyze the effectiveness of COVID-19 vaccine in the long run. So, this was our evaluation plan of COVID 19 vaccine. And I really thank all of you, healthcare leaders, for listening to me with great patience. As they say, that to be a good leader, you have to be a great listener. So, thank you so much for being a great listener. And I hope all of you have a good day ahead. Thank you.